Greetings, everyone. My name is Shayma Abulbaha, a research assistant from the College of Pharmacy in Qatar University. And today I'll be presenting a research poster on behalf of Dr. Monica Zolezzi, an associate professor from the College of Pharmacy in Qatar University, and also the principal investigator of this work. This research project has been conducted by two undergraduate students, which are Halima Saadia and Safiya Habib. The poster is titled as Portrayal of Autism Spectrum Disorder and Related Treatments in Qatar's Printed Media. So now let's start with the background. Autism spectrum disorder, or ASD, is a complex neurodevelopmental condition, and patients with this disease experience a triad of symptoms represented in challenges with the social interactions and the verbal and nonverbal communication. Unfortunately, it has been found that the stigma surrounding this disease is very common in the Middle East as well as the West. And the major contributing factor to this was found to be the media, as it has been documented that the representation and portrayal of mental illness by the media, and especially the newspaper, highly influenced the attitude of the public. Since many studies done in other countries reported the stigmatization of autism in the media, it's important to evaluate how journalists address autism in Qatar's newspaper. This is important, particularly regarding the available treatments, which are often only briefly discussed and not evidence-based. Therefore, this study was conducted with the aim to have a better understanding and evaluate Qatar's media behavior towards the portrayal of ASD and how they consider the evidence behind the treatments available. So in order to achieve these objectives, we have followed a retrospective quantitative content analysis for the non-textual data and qualitative content analysis for the textual data published in the leading printed Qatari newspaper. And the methodology section is presented here for you. 3 English and 3 Arabic daily Qatari newspapers were selected for this purpose, and those newspapers were reviewed retrospectively from August 2019 till August 2020. The inclusion criteria were Qatari daily newspapers with online PDF archives of the printed versions, and the eligible articles should have ASD as central, which means having autism as the main idea of the whole article, or a subordinate theme, which means having autism as the main idea of a paragraph in the whole articles. We have excluded the repeated news within the same newspapers and articles that used autism metaphorically only. And we have used multiple keywords as presented here. And for the English newspapers, we've used ASD and autism. And for the Arabic newspapers, we used tawahud. For the analysis, for the quantitative analysis, we've used SurveyMonkey, Excel, and SPSS software. And for the qualitative analysis, we used a predetermined coding approach. And under the qualitative analysis, we used a subgroup analysis to compare the mentioned treatments with the current practice guidelines and the primary literature. Now, moving to the results section, the quantitative analysis revealed low coverage of the media to ASD, and majority of the articles were found to be in relation to general or local events only, with little focus on the scientific aspects of the condition. And the discourse analysis revealed significantly more stigma towards the condition in the Arabic newspapers compared to the English ones. And based on the current practice guideline recommendations, most of the treatments discussed had insufficient or lacked scientific evidence. And majority of those treatments are presented for you here in table 1. So to conclude, results of this study show that there is a need to improve how newspapers cover ASD and its treatment, and more scientific and responsible writing is needed, particularly when making treatment recommendations for this condition. This brings us to the end of this presentation. I'll be available during the poster session in the Abu Dhabi Mental Health Conference, and I would like to hear your feedback and welcome all your questions. Thank you so much for your listening.